We're going to speak with the Chief Nursing Officer from Henry Ford West Bloomfield Hospital. She is joining us now on the MegaCast. She is Stefanie R. Newman. Stefanie, welcome to the MegaCast.
Thank you.
How are you? How's your team?
We are doing very well. We seem to be coming out of all of the pandemic high peak time. So we are doing fantastic now. A lot of our patients are doing well, so we're happy. It's Nurses Week. We couldn't ask for a better time.
That it is, and thank you, and thank your nurses for all that they're doing right now, and that they were doing before, and what they will be doing in the future to keep our communities safe and our people healthy as much as possible. From what I've heard from my producers, you just started this position at Henry Ford West Bloomfield Hospital as their Chief Nursing Officer. What a time to start! It's been quite a trial by fire, I'd imagine.
Yes, it's. I told and teased everyone here that normally when I start a new position, we have record-breaking snowfall wherever I've been, and I come here and I have COVID. So it's been it's been quite an interesting time for me. But instead of taking 3 to 6 months to get to know people here at West Bloomfield, it's taken me about a week to get to know people. But it's been a trying time. But it's when nurses really excel at what they do. Nurses and physicians, the whole team did a fantastic job through this pandemic at our most vulnerable time.
So what are some of the new challenges with COVID and as the COVID-19 crisis hopefully starts to wind to an end, what are some of those new challenges that your nurses are facing during this time?
Well, one of the things that we are working on right now is how to phase some services back in, using our volunteers, having visitors come back whenever the governor lifts her order, and also phasing surgeries and ED visits that are non-COVID related back into our business every day.
More people than ever are being discharged from hospitals right now that had COVID-19. And as you said, it's going to mean more of these other procedures will start to reemerge at the hospital, more of the elective and at least the non-timely, the elective, the non-timely, and the timely procedures that were delayed during this process. But COVID-19 has presented its own challenges, and with these non-COVID patients coming back in the near future and beginning to be treated more often than has happened during this crisis, what does your team do in that case to keep your COVID patients safe continuously, and also with this virus still out there and there not being a vaccine, keeping these new patients that will be coming in also safe during this process?
Yeah. Well, the whole team has been working on, before it seemed as soon as COVID got started, we started looking at how we're going to phase things in and keep other patients safe, because we did have other patients with other illnesses come in during that time. We, and all emergency departments, I would imagine, but definitely the Henry Ford Health System emergency departments do still keep all of our patients separated who have COVID symptoms. We keep them separated from patients who may not have COVID symptoms that are coming in for diabetes symptoms, for high blood pressure, common cold type symptoms. So we keep our emergency departments separated for those patients. We screen every person that comes into the building. We're still not allowing visitors right now. But we do screen everyone that comes into the building. So that really helps us.
Stefanie R. Newman, Chief Nursing Officer at Henry Ford West Bloomfield Hospital, on with us on the MegaCast. There's been a lot of struggle throughout the pandemic to maintain PPE stocks in hospitals. Did this shortage hit Henry Ford, and how did your team work through it, if it did?
We got very close to being at critical shortage levels, but we also were able to implement some conservation measures. So we never really did run out. We may have had to use different products that we were not, different brands of PPE that we were not accustomed to. But gowns for the staff, gowns are gowns as long as they are able to take care of their patients and they feel safe wearing the PPE. So while a lot of places did experience shortages that were critical enough to cause concern, our staff within Henry Ford Health System were always, they always had PPE available to them.
It's reported that the stockpile now of PPE in hospitals is higher than it's been at any time during this process. Is that the case at Henry Ford, or is it at normal capacity at this time?
Right now, we have quite a bit. I think it is probably our normal capacity right now. We haven't experienced any overages because, of course, we're, the whole country is having to kind of restock, for lack of a better word. But again, we haven't experienced any issues with our nurses having PPE, which is great.
That is great. We've talked a lot recently also about the mental health implications of COVID-19 for civilians, particularly our senior population. How have your nurses, how have the medical professionals at Henry Ford been holding up during this? And what are some of the ways that your team works to work through this from the mental health side and keep each other in as best spirits as possible?
Yeah, we have our employee assistance program to help a lot of our staff. We have a wonderful chaplain here who went above and beyond what his job description is to make sure our staff were safe, and they had someone to talk to other than themselves and us, because it was a pretty traumatic experience for us. But a lot of resources that Henry Ford Health System have made available to us, and they continue to make available to us. We're also developing a plan as a system for wellness and to be able to help each other and lean on each other. So I look forward to that coming out as we wind down, or we seem to have declining patients coming in from an inpatient perspective of COVID patients.
We talked earlier on the program today with another nurse James Estabrook. He works in a hospice facility, and I asked him this question. I think it'll be good to get a perspective from the hospital side as well. With this being Nurse Appreciation Week, and with us talking so much about showing our appreciation for the frontline workers, for first responders, what can we do as civilians right now and as we go into the future in this process and beyond to help those on the front lines maintain safety and just to help them do their jobs as effectively as possible and as safely as possible?
Well, what I will tell you is that the community has been fantastic to us here at West Bloomfield Hospital. There were a few times when things were pretty misty for me, when you walk out and you see all the thank you signs and people, we had a parade of sorts from the community, and then our first responders on the outside of the facility. So that was actually fantastic. The community has shown us so much love. I think the one thing that we ask of the community is that you all please do stay inside. Please adhere to the governor's stay-at-home orders so that you can stay safe and stay healthy. It is the best thing that you can do for us as healthcare providers.
Chief Nursing Officer Stefanie R. Newman from Henry Ford West Bloomfield Hospital joining us on the MegaCast. Stefanie, before I let you go, anything else that you'd like to say, anything else that maybe we haven't touched on you think would be important for our audience to know?
Yes. While we're saying that, we want you to stay in as much as possible to stay healthy, for those people who have chronic illnesses or experiencing illnesses, our emergency departments are open, and we would encourage you, if you're not feeling well and it is not something normal that you feel you can take care of at home, know that our EDs are safe, our physician offices are safe. We're taking extra precautions to ensure your safety. Please do not stay at home when you're ill. I would also like to say that May is National Stroke Awareness Month. So if anyone is experiencing symptoms around weakness in the face, arms, and legs, slurred speech, loss of vision, inability to walk, please dial 911 and get to an emergency department as soon as possible.
Okay. Chief Nursing Officer Stefanie R. Newman from Henry Ford West Bloomfield Hospital. Thank you very much for joining us today on the MegaCast.
Thank you. Have a good day.
You as well. Stefanie R. Newman, the Chief Nursing Officer from Henry Ford West Bloomfield Hospital, joining us on the MegaCast.